Do not fear anything if you have great plans. And that is not one plan. That is plan A, contingency plan B, contingency plan C, and D. And in order to do that, lesson 2 is have a team that is ready to execute on those at any given time. Trust them.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take.
Welcome to today's StartUpHealth Fireside Chat. In this weekly series, we bring in some of the most inspiring and interesting people in health innovation today, and we have candid conversations about their work, their passions, and the future of health itself. I'm Logan Plaster, and I get the privilege of being your host for the next hour. Today, I get to welcome Brigitte Nettesheim, Aetna's president of the North Central region and joint ventures. In her role, Brigitte leads market strategy and has a big impact on how Aetna and CVS relate to consumers, big employers, as well as providers. We're going to get into all of that today, as well as learn some of the rules of the road for how startups can work directly with Aetna and CVS to grow and to scale. So it's going to be an awesome conversation. Excited to have all of you along for the ride. Brigitte, welcome to today's Fireside Chat.
Thanks, Logan. It's great to be here.
Let's start with you. Let's get to know you a little bit. Tell us a little bit about your background. Very interesting roles. I say roles because you've got 2 jobs at this company listed here. Tell us how you came into this position. Did you join before or after the acquisition of Aetna by CVS?
Sure. And maybe it helps to understand a little bit more about my background. I'm a farm kid who literally grew up on a farm in the middle of nowhere, Illinois. Joined the military to be able to afford college. I was lucky enough or fortunate enough to go to the military academy at West Point. Didn't even know what I was getting into. And so that may tell you a little about me in terms of when my back is against the wall, I'm going to make the boldest move I can. And so flew helicopters when I was active duty Army. Super fun, but it also tells you a little about me. I'm somewhat fearless, cautious, have to plan, but fearless. I joined actually Caremark, believe it or not, the PBM. I joined that company, my first civilian job. Caremark had nothing to do with CVS at the time. I worked there, went into provider strategy consulting, went to get my MBA, and then moved into Aetna. Provider strategy consulting was amazing. I will always appreciate that work that I was able to do, but I recognize that no one on the provider side who was doing this management strategy consulting understood the payer side. It really bothered me. So I thought, I'm going to go learn the payer side and go back into consulting. So I joined Aetna, believe it or not, in 2005. And so that was long before CVS acquired us. And had various jobs there. So I've worked in medical economics, in finance, in network, and network, not network contracting, but really innovative network solutions. I worked in our national accounts organization with our largest employers who purchase health services, and then moved into this little startup group that didn't even have a name at the time when we knew ACA legislation was pending. And our charge was, hey, figure out how we diversify revenue streams. And let's think through how to do that by helping providers with this concept of the ACA legislation and what they're going to need. We didn't even have a term for value-based care at the time, but what services they're going to need or how we can support their efforts in that. And that became Aetna's Accountable Care Solutions organization, which ultimately ended up in building 5 joint venture health plans. And when I say joint venture health plans, these are affiliate health plans of Aetna, now Aetna and CVS, that are jointly owned, typically 50-50, by a provider organization and the payer, which is Aetna. So I'm able to run that portfolio. I still sit on the board of all 5 of those. I don't directly run them. We have our own C-suites that run them. I also ran, and I say this because it just changed. I ran essentially a P&L, which was our Medicare and commercial health plan for the whole Midwest for a few years, and have recently been asked to take on going back into the employer side in terms of being an administrator and a health insurer for our largest employers. So that would include employers that have both the PBM on the Caremark CVS side, the Aetna side, as well as some that work with Aetna only.
Brigitte, I got to dig into your story just a little bit because of the West Point piece and flying helicopters. It's just, it's too good to not go a little deeper on. Everyone on this call is really trying to be the best kind of leader that they can be for their own little unit, which their startup, you know. And I think about the lessons of leadership that you learned at West Point and were able to bring into the business world. And I wonder if there's just some like top line words of wisdom that you could share with folks in this call about some of the leadership lessons that you learned that you think really apply to small business units as well.
Yeah, I mentioned one, that's be fearless, but plan. And so do not fear anything if you have great plans. And that is not one plan. That is plan A, contingency plan B, contingency plan C, and D. And in order to do that, lesson 2 is have a team that is ready to execute on those at any given time. Trust them. Trust that they know and understand your mission, your purpose. They trust each other, most importantly, right? So that means we can't, as leaders, micromanage. We cannot do it all ourselves, and we shouldn't, because that limits us and that limits the business that we run. So those are, I think, the most important aspects that I continue to lean on from West Point. Other than that, kind of the big picture strategy, always thinking big picture strategy. Because yeah, you may be one little cog in a giant wheel of healthcare, but understand the dynamics of what's going on in the military. That may have been geopolitical as much as understanding the other forces that you're fighting against at any given point in time. And it's no different in the business world. What's going on from a federal legislative and sort of political environment? What's going on at a state level? How do those interact or not? Who's the competition? Who's the new competition that's emerging? What could they be doing? Very similar in terms of thinking strategically all the time as well.
I love it. That's great. Brigitte, you give me an overview of your job or your many jobs there at Aetna CVS. But let's get down to your day-to-day and specifically kind of what are some of the biggest challenges that you face in that position?
Yeah, so I'll give you a perspective of my role running a health plan P&L, commercial and Medicare. And it's not that different, but I'll sort of add on some of our biggest customers and what they're facing right now. So some of the challenges are just the complexity of working with multiple entities across the healthcare spectrum to make it easy for consumers of healthcare. So we consider every one of our members as Aetna a consumer. We certainly have consumers across the entire CVS spectrum. And so how can we get away from manual bills and EOBs that are very electronic, right? That's what they're supposed to be. But how do we get away from the manual ones that are really hard to understand? How do we have a pharmacist understand benefits at the point in time a consumer is seeing that pharmacist? How do we work with multiple types of provider organizations? So that's large health systems, that's primary care physicians, that's specialists, that's long-term care facilities, multiple layers of provider organizations across multiple markets as well. That complexity in and of itself is so frustrating to every single consumer of healthcare, including me, and I guarantee including every single one of you. So the biggest challenge is, how do we make it simpler? All the time, how do we make it simpler?
I wonder if it'd be helpful to kind of drill down into one of those areas of complexity and look at really how you are trying to make it simpler. So obviously those are sort of big bucket areas that we all agree on are frustrations, need to be made simpler. And you're obviously dealing with actual solutions, and the folks on this call are trying to build actual solutions to fit those problems. So maybe just as a case study, is there a particular area that you could dig down into and show us what you are working on?
Yeah. So I can give you two. I can give you one that has more history and where we are today, and then I'll move, and that will be access through telehealth, which was very different 5 years ago than post-pandemic or coming out of a pandemic, and how that's accelerated. So talk about that first. And then second, I'd like to talk a little bit about price transparency and all of the pending, well, we have some federal mandates out there, but we're pending regulations on much of that. And how are we thinking about that in terms of creating simplicity? So the first, I'll talk a little bit about virtual care. When we started in the virtual care realm, I think there was Doctors on Demand, Amwell, maybe a little bit, Teladoc. I mean, this was years ago, and we wanted to bring that access to, right, expanded access, more simplicity to the general commercial and Medicare population, starting with commercial. And I will tell you, we worked with Teladoc for years and couldn't get more than literally a 2 to 3% uptake in using any type of virtual care services. And at that point in time, it was primarily, or it was almost all primary care. We just couldn't get an uptick. We did through one of our joint ventures, because we can create pilots. So an organization doesn't necessarily have to scale big to do a pilot or be able to scale big at that point in time. We started working with all of Aetna, and CVS was working with Teladoc. And we said they're just not quite ready to work with as many different provider nuances as we need in this joint venture. Because remember, our partner is a provider at this point in time, so we can't compete with them directly. Well, 98.6 came in, said, I think we can do this. I think we can create something that works for you, Banner Health System, solve your problems on your needs for virtual care. Remember, pre-pandemic, and we can work with you, Aetna, on your side and not interfere with anything you have going on across your large carrier services. Great, let's try it. And we racked our brains and we worked our tails off to get that up and off the ground. Within 6 months, the pandemic hit. And all of the fighting with CVS and Aetna to get this thing in place, because internally, I do a lot of that. I have to fight with multiple competing organizations and interests. Within 6 months, the pandemic hits, and Aetna and CVS turned to us and said, by the way, we need that solution to be scaled across the whole US right now. And so we're able to work with 98.6 to scale that as fast as we could. And honestly, one example of how a pilot solution, we were able to scale it very quickly, bring that to market as fast as possible. And it worked well for everyone involved at that point in time. So hopefully that gives you an idea of sort of how we started. We were trying to solve an access problem. The whole industry wasn't moving that way. I will never say that we were fortunate to have a pandemic, but in this case, we were fortunate to have a partner who could help us react to a problem that was exacerbated by the pandemic. So let's think about price transparency. And there are a few of you on video. How many of you are knee deep in the concept of the federal mandate for price transparency? If not, I'll give you a little background. There are a few components to a federal mandate. It started under the Trump administration. It is continuing through the Biden administration. So think of price transparency on a few levels. Ultimately, the goal is, and actually Alex Azar, I saw him and Donna Shalala on a panel. I was fortunate enough to see those two on a panel in August. And Alex Azar said, We did this because we believe it will be a fundamental or foundational shift in how healthcare works and being more consumer friendly. And so price transparency, effective 1/1/21, the first part of it, the providers were supposed to, at minimum, to be just compliant, have machine readable files available that were publicly available that show the prices they charge for services. Can you, for any of you who work with hospital systems, imagine the complexity of that? I'd say 20% of the way there right now. And that was effective 1/1/21. Now it's been pushed back a little, 7/1/22, payer organizations, and that isn't just, those aren't just, I'll say insurer organizations. So this includes self-insured, large self-insured employers. We have to provide the same type of information. How much are we paying for services to different providers for each service? Imagine how complex this is. The initial sort of first wave of this is going to be minimally compliant. Are we just compliant with the law at this point in time, or the regulations that are coming down? Okay, great. That's going to cost a fortune, and we're going to do a lot of work. So the work I'm doing, I'm the executive sponsor for it within Aetna and across CVS right now, is thinking about 5 years from now, what do we want this to look like? How do we lead the way? How do we start to integrate all of this information across a PBM, across insurers, across all of the access we have to different provider organizations to make it consumer friendly? So they're not just these ugly machine readable files sitting out there, but we actually have tools available that truly give consumers a view as to what they will be charged on both a personal level. So what are they personally responsible for? And also access into what the total cost is, because that's just as important for all of us to think about access at an affordable price.
That's very helpful, Brigitte. And I know a lot of folks on this call are working, whether directly or tangentially, in that price transparency arena. That relates to this next theme I want to get into, which is the fact that you interface between Aetna, CVS, and some of the world's biggest employers. You think you told me Bank of America, Cisco, Marriott. And so often health startups think that if they can just get in with one of these employers, that they'd be able to grow and scale, with a single client versus going direct to consumer. This is seen as a strong go-to-market strategy. And so you've got this incredible vantage point of really understanding how these big employers are thinking about health innovation, about how to spend, about what they value. And so I want to sort of spend a minute thinking about large employers and how they make some of these purchasing decisions. So just top level, sort of, how would you describe how some of these, I named 3, how they're thinking generally about health innovation right now?
A loaded question, because there are probably different archetypes of purchasers. I call them purchasers. This is behind the US government and inclusive of state governments. So behind government, commercial employers are the largest purchasers of healthcare services in the US. And oh, by the way, right, the fastest growing industry in the US. And so it's very important how they purchase, what they're thinking. A couple of things. One, understand the influencers. So who influences the purchasing decisions of these large organizations? The benefits consultants. Do not overlook the benefits consultants. The Aons, the Willis Towers Watsons, the Mercers are going to work with your biggest. And then it goes sort of down, and I would say just hundreds of other ones who will work with mid-sized employers and small employers. It's important to understand those consulting firms, their influence over all of these purchasing decisions, and they have their own interests also. So remember, every solution that maybe my team is trying to put together at Aetna and you're trying to put together, those consulting firms are also trying to put together their own solutions, be it care management solutions, be it very specific chronic condition solutions. Think of them as sort of healthcare point solutions, we would call them. They're trying to do the same thing. So they're major influencers on these decisions. But then when we look at the employers, well, what do they care about and how do they make purchasing decisions? And I will say different archetypes. It's very important to understand the employer that you're trying to work with. So are they a value buyer? Okay, they're just going to go with the cheapest option because you know what? They run a retail operation, they're Nordstrom, and it is not an easy time for them right now. They're a value buyer. That's it. I'll say a price buyer at this point in time. Are they in an industry like healthcare where the war for talent is really tough right now? So they're actually thinking of benefits as an added way to retain and recruit. Are they looking at are they Goldman Sachs or BCG or McKinsey? And they want the highest end services and the coolest next new thing. Very important to understand that as well. And by the way, this fluctuates over time. It depends on the industry they're in. It depends on the labor market. Yeah, go ahead.
Speaking of fluctuating, any tactical advice on really ascertaining the archetype of your purchaser, really understanding these changes? Because you said it comes in and flows out.
So two things that I always study. One is the industry. So what is the industry that employer is in? Do I understand the dynamics of that industry? And two, what's going on in the labor market overall? And that doesn't mean like the economists' projections for labor market necessarily, but look at all the HR websites and say, okay, what are they thinking about from an employee recruitment retention perspective? Right? Do they need help with the work at home hybrid solutions? And what can we offer that would help them with that? Right? That's a very timely topic for them. So I always look at, now I can't remember, SHRM website, the Society for Human Resources Management. It's a really good website that you could go on to and just literally click through and say, okay, what are the hot topics for HR benefit managers right now? One trend we're beginning to see, and I hope it continues, is that benefits are falling under either the CFO, because it's a huge liability sitting on the books at any point in time if you're self-insured. So either the CFO or they're bringing in a physician to run benefits, which I think is probably the best solution. Quest Diagnostics has done that for a while. It is absolutely, in my mind, a best practice. And especially when there's a partnership between the physician leader and the CFO, really thinking through trade-offs of what health services cost and what is beneficial to the workforce.
I want to get really specific about, how does a startup really, you said you needed to know and get the attention of a benefits consultant, but really how does one go about that? And, what are some of the specific challenges? You said some of these groups are trying to create their own point solutions. And I just wonder what your thoughts are on what sort of gaps are then left that startups really do need to step up and fill. So are you seeing some themes in terms of specific challenges that benefit consultants are facing right now?
I don't know if I would say benefits consultants are facing challenges. I would probably reframe that question, if that's okay, Logan, to say, what challenges are we facing across the healthcare industry? If we think of every US, right? Everyone who lives in the US as a consumer, what challenges do we have? And where do you want to focus in defining those challenges? Is it in health inequities? We have a lot of challenges in the inequity of access to healthcare services at the same level across zip codes. I live in Chicago. I mean, we see it every single day. So literally, you can just hone in on one piece of where we know there are issues and how we try to solve them, or we can go globally and say, I have 50 solutions I can piece together from thinking through, what are they called? Like the people who set up the benefits internally and help you do all of that. to someone who's going to provide telehealth services, to who actually helps administer my health plan, to who administers my pharmacy management, to who, right? I mean, you can literally bolt on sort of 50 different solutions. So one of the issues is, how do you pull all of those solutions together and make it simple for an employer who really is trying to do best in class across multiple areas that they're accountable for? That's a major struggle for employers right now. We struggle with it enough as Aetna, trying to pull all of our solutions together and make it simple.
Yeah. The purpose behind my question was this idea that, to get to the employer, you got to get to the benefits consultant, and to get to anyone, you have to understand their challenges, their specific challenges, to really reach them. But you're saying you have to balance that with this understanding of how the whole fits together. Is that what I'm hearing?
It is. So I'll just give you an example of how we as Aetna or CVS may come across a new idea or any one of your businesses. And believe it or not, it's through things like LinkedIn. Hey, publish a quick, you don't have to do some great peer-reviewed white paper, right? Put some opinions out there. And it might not be LinkedIn. You might do it through other platforms. How do you do that? How do you get on a circuit of getting in front of people? So sometimes that's Health Evolution Summit, which is a very big and important, I think, forum for healthcare leaders. How do you get to the table there? And initially, it's maybe how do you just attend and start to pitch your idea? And then you start to get on the stage and talk about it, or smaller forums or whatever that is. I think that still works. That is still how, we all get to know you and your businesses. Is that what you were asking?
Yes. Yeah, no, that's super helpful. I do want to drill down even further into how Aetna CVS partners with startups. Maybe just some basic lightning round. What stage would a company need to be at to partner with you? How do you invest? How does the process work?
First of all, we do have a fund that invests in digital solutions. We do not yet have, it's relatively new. I would not say we have this list of 20 questions to answer and you're in at this point in time, but we think that's very important. We think the digital front door is critical, and we want to facilitate a lot of work in that area. We're not going to get it done ourselves. No matter how much we spend, we're never going to be able to do it as well as a startup company or a smaller company will. So that's one area, just to let you guys know that.
When did that begin? That's a new initiative?
Yeah, like within the last year, I think. We announced it during the pandemic.
Okay. Do you recall? We can share information about that, make sure everybody knows.
Literally, there's we did media blasts and stuff on that one. And I apologize for not knowing the exact date.
No, it's all good. Okay, so in terms of stage, and you said you don't have a specific 20 questions, but just general brush strokes.
I do have some questions that I would ask first. And my recommendation is, number one, always pick a pilot. Do a pilot, because working with someone like a CVS can crush you. It's for those of you who did any sort of studies in your MBA work, it's the Walmart conundrum. Awesome, we got the big customer. Now you're beholden to the big customer. So I would say pick a pilot, learn, test and learn constantly. It's the way to get to know someone. That's certainly the way we helped 98.6 scale very quickly. I think it's a really good model. But here, I did write down my questions, Logan, because you warned me. You said, what are your questions? What do you ask? So I do ask, hey, what are your purpose, mission, values? So, right, I'm going back to my West Point references earlier. That's not just me. It's very important to CVS. We would not want to take on reputational risk inadvertently. I will say that. We do have many resources who work compliance, who work media relations and communications. And as burdensome as that sounds, right, the more aligned we are on mission, values, the easier it is to get through that sort of process. The second is, how connected can you be? So whatever solution you're bringing to the table, can you connect with other vendors and or with, and believe me, across CVS, we work with more vendors than I can count on all of my fingers and toes 20 times over. We do. And so how connected can you be? How flexible in terms of that? And how flexible do you want to be? It's okay to say, no, we can't be flexible there, but just have an opinion on that. The next is, I talked about it, can you scale? And it's okay to say, no, not right now. We need a year. We need to learn more over the next year. That's okay. Just answer it. Like, can you scale? If so, when? If you're never going to scale, how should we think about the scope of how we work together? Another one is, how are you funded? So we're very careful about if you're funded and backed by venture capital, private equity, what's the ownership structure? When's the expectation that you flip? It has happened before where we literally sign a contract with someone and a month later they're sold to Optum. So that they would be a competitor of ours. And then it's just a big hassle. So we're careful about asking that. And that's why we do it. Some of it's reputational, some of it's business risk, that kind of stuff. And then kind of related to that, what's your end game? What do you want for your business? And have an opinion on that. It can change over time. And I get that, but be very definitive there about what your end game is.
Those were great questions, Brigitte. I want to get to a couple questions in the chat. Let's go to Jim Fang from Fixable. Jim, you can come off mute, explain what you do, and ask you a question.
Hey, thank you for this. It's been great so far. A lot of deep down knowledge in regards to getting to market. Speaking of which, that's my question. From a go-to-market strategy, do you suggest companies with market-ready solutions to first win with the consumers and the customers and the individual corporations, and then work your way, from the bottom, work your way up, or versus a top-down strategy? So some of which you already pointed to today.
You said or. I would answer and. And it's more about, there are multiple channels in the healthcare realm. Right. So I talked about government paying, commercial, employers paying. There are providers who pay for services. And you can sort of go down the list of how it can work. And I would say, don't pick a channel first. Test, do multiple, even if they're just pilots, have multiple channels that you're working through to see where you're resonating best and or where you think you can grow the fastest. And hey, we all run into each other at some point in time. Even in 98.6 sells directly to employers, they sell to provider organizations, and they sell to payers. And at some point in time, in fact, I just had a conversation with one of the executives. He said, you warned me this was going to happen. Now we have all this channel conflict and I've got to choose what I do. But they were able to scale very quickly by doing that and then have the choice instead of someone making that choice, whether the channel was close to you or not. So I hope that was helpful.
Oh, that was perfect. Some of the strategy I think we took from the beginnings as well, but wish I had this conversation, 2 years back.
It's crazy trying to figure out multiple channels that you're selling through and what their needs and desires and wants are. I think as long as you, at the heart of everything you do, think about the consumer, you'll figure it out.
Thanks for the question, Jim. Let's go to another question in the chat with Rehan Faroki from In Recovery.
Yeah, thanks, Logan. Hi, Brigitte. Thanks so much for this great chat. I'm a growth advisor at In Recovery and had a question around how you're thinking about B2C addiction care and thinking about substance use disorder as a chronic disease and how that's managed. And if you've had conversations internally or with other companies of delivering that in a more affordable and accessible way, either through the pharmacies or directly to the beneficiaries.
So Rehan, topic of the pandemic is how do we integrate the concept of behavioral health or mental health, whatever you would like to call it, with medical, because they're so interrelated. Again, from a consumer perspective, why do we have mental health benefits, behavioral health benefits, and then medical benefits? Why are we doing that? And so we work constantly to integrate the two. So yes, this is very important to us. Our CEO, who I'm just going to put a plug in for her, was named Fortune's #1 most influential woman in business, Karen Lynch. that she came from Magellan Healthcare. And so she knows the behavioral health world in and out. She knows the medical insurance world in and out. And so we do a ton of work to integrate all of this. Substance abuse, addiction assistance and substance abuse are very critical to everything we do. And then I would say, Rehan, personally, I sit on the board of an organization called Community Anti-Drug Coalitions of America, where we work through local communities to fight substance abuse and to combat addiction. And so, yes, it's important. It's so personally important to me that that's what I choose to do in my free time.
Yeah, no, that's so great to hear. I'd love to connect offline about that as well. I do a lot of health equity work in addiction as well, and understanding that addiction care is not a right, it's a privilege. And seeing how we can try to deliver that outside of the treatment centers directly to patients. We've seen a lot of startups in this space focus on telemedicine, delivering, mat therapy. We think that there's a wider potential here, and would love to hear your thoughts on that.
Yeah, and honestly, providers are struggling with this tremendously. I work a ton with Aetna Health in Minneapolis, and their retiring CEO, a wonderful woman named Penny Wheeler, she's very passionate about this. And she is about to, I think, lead an effort at a state level on trying to define how the state is tackling a lot of the behavioral health issues. So I think that would be a good conversation.
Appreciate the question, Rehan. I think this gets at a larger, very interesting question about the future of healthcare delivery and kind of how a company like CVS plays into that as a community node of health. I think I saw a press release that just a couple of weeks ago, CVS announced it was investing $25 million in affordable housing in Louisiana, I think. And I was curious, your thoughts on how that speaks to this larger integration of what the definition of health is, and how a company like CVS and Aetna is going to be thinking about the social determinants of health going forward.
So we actually announced before that $600 million of investment to combat social determinants of health. So Louisiana is one place we're doing it. We've done it in Denver. We've done it in Virginia. We've done it in the Atlanta area. We've done it in Chicago. Just understanding that housing is a basic human need, right? Shelter is a basic human need. And without that, it's very tough to think about higher order concerns regarding your health. And so we'll continue to tackle it through housing. We do a ton with different food pantries, right? Organizations that just provide nutritional food as well. So it's not just about housing. We really think about social determinants. We go down to a zip code level as local leaders. And I represent Chicago often in these conversations. We partner with the county, the city, the state. What can we do? What are other organizations doing? How do we fill in some gaps there? So it's not really about, hey, let's get some press for CVS. It's really about how do we build healthier communities? And it's really our obligation to think about how we use our retail footprint, how we use the pharmacies and the pharmacists that are very trusted in communities, how we work with health systems to get them in line with giving to a lot of these causes as well.
I know those social determinants are very personal to everyone on this call. And so I wonder if there are particular gaps that you're seeing that I'm always trying to understand, connect the challenges of our guests with those projects that our founders are working on. Are there specific areas, whether it's housing or something else, where you think there's a particular need for healthcare startups to step in and really bring their innovations to the table?